So guys, I've been finding it really tough lately, and I just wanted to share this moment to give you an insight into what it's like being a new graduate, and you're probably experiencing the same things if you're at this stage of your career. And what I've been finding it kind of most challenging is having to prepare all your patient notes, and I find myself wanting to check emails or procrastinate because it is really tough to think about lots of new conditions and you're tired after a long work day, but you need to prepare for the next caseload tomorrow. And so it can be quite draining after you do this day after day and week after week. And you know you need the preparation, because if you don't, you're going to progress your patients a lot slower. You're not going to have that vision of where you're heading. You might forget to check the right objective markers, and so you don't actually know how they're doing in relation to when they first saw you or when you last updated your objective markers. And so it is a really important part and process to prepare for your patients, but it can also be a really challenging time, and a time that is both takes a lot of time as well as a lot of energy to think and research on different conditions. But when I am struggling, I come back to the idea that both for the patient's improvement and my self-improvement as a physio, it is a gradual and a progressive thing that you do have to do this preparation to learn, and then you start to have those more automatic processes and thinkings that will guide you and help you make quicker decisions essentially along their pathway of progression. And so I try to remind myself, when I'm feeling stuck or overwhelmed, what is the one big thing I want to get out of this session? Because at least if I can come back to that overall idea and know that that step, even if nothing else gets done, will help them progress, that's a good framework I like to have and helps me stay on track a bit more. I'm not sure if this will continue throughout my years as a physio, or if it's more of a new grad thing. I guess time will tell in that process, but I wanted to document this because I think a lot of other new grads will be feeling the same way that I am right now. So I just want to share this to say it's common, you're not alone, and that, yeah, reach out. And it also brings me on to the point of, because you are seeing so many new cases, you're not exactly sure how they're meant to progress or what exercises you're allowed to do. Are you allowed to load them? Sometimes the surgeon's notes are a bit vague, and you're not exactly sure what limitations are around that, and you don't want to obviously mess up a surgery or set them back. So it's super important to find yourself a mentor who's available just to have a quick chat or a quick email to ask a couple of things. Am I allowed to load it at this angle? Because they will just have that knowledge of, no, you should avoid that angle, or you should avoid that exercise at this stage. Are they progressing how they should? Has the swelling gone down nice and quickly? All these things that as a new grad you're not often aware of, because you just haven't seen a number of those conditions. You don't have the reps in to see what a typical presentation should follow. And so having someone you can reach out to quickly and get a response from is so important. So if you've got this mentor, fantastic. Don't let them go. Keep a good relationship with them. If you don't have a mentor like this yet, reach out. You've got to try and network or find someone who is willing to grow the next generation of physios. And I think you'll be surprised at the number of more senior physios who are willing to invest in that next generation. It's quite a good industry for this. So don't be afraid. Even if you get a couple of rejections, there will be someone who's willing. Keep knocking on those doors. So that's just kind of a reflection of what I've been thinking for the last few months, and definitely been a permeating thing throughout my whole first year since graduation. So just wanted to share that with you, and yeah, reach out to one another, help your friends out, find a mentor, and I'll see you in the next video.